I think, Dr. Taylor, first thing we need to kind of get out of the way, what exactly is contact tracing?
So contact tracing is an effort to identify individuals who would be at risk of acquiring an infectious disease due to having been in contact with someone who's later found to have been infected with that disease. And it allows us basically to try to minimize the transmission, as well as identify in advance those individuals that we need to be paying attention to, advising them of their risks, and encouraging them to get appropriate care.
I'd never heard of contact tracing, but I understand it's been around for a while.
It has. It's actually one of the oldest and most effective control measures that we have for infectious diseases. It's been employed for quite some time at the state and local levels, and even at higher areas. So in the example, as an example, in the 1930s, it was actually used for efforts to reduce transmission of venereal diseases among American troops. And of course, at that point, we had less efficacious treatment, and so it was absolutely essential that we control that transmission. And so it's been employed, well over those course of decades. It becomes important and critical anytime we have emergence of a disease that is transmissible, particularly any that are hard to treat, and that where prevention becomes so important. And so it certainly played a notable role with the H1N1 influenza pandemic back in 2009, as well as the original SARS, right? So we don't necessarily call this SARS, but it is recognized scientifically as SARS-CoV-2. And so with the original SARS outbreak as well. And so because those situations don't have vaccines or readily available treatments, and so control of transmission becomes so critical. We also do it in Oklahoma and throughout the world with tuberculosis. Would be another disease that is very commonly necessitates contact tracing. And for tuberculosis, it is treatable, but it can be very difficult to treat and very protracted. And so we want to try to control its transmission as much as possible, rather than just relying upon treatment.
Well, that contact tracing must have worked pretty good for SARS #1, because we haven't talked about it for an awful long time.
Yes, it did. It worked very well. Of course, the advantage that we had there was the limited transmissibility that it had relative to the SARS-CoV that we're dealing with now. And so the spread with which this virus came into the population just overwhelmed our ability to do the contact tracing in its first wave. And so we're hoping to rectify that. I believe we can rectify that with the improved testing that we have available. Testing is certainly a critical part of it, because contact tracing, again, you identify those individuals who are at risk, and of course you encourage them to go and get tested and find out if they've actually acquired the infection. And back when we had so many limitations on our ability to do the diagnostic testing, as well as the number of contacts and the number of cases that we're seeing, we just couldn't get in front of it. But we believe that we have those capabilities now, and that's the goal and the plan as we open up.
Let's talk about that. Let's say I have a positive test and we need to do some contact tracing with me. How is that going to work?
So the first question that we would ask of you is basically, or ascertain whether or not you're symptomatic or asymptomatic. And so if that positive test is associated with you having symptoms, then we want to go back in time to at least a couple of days before you had symptoms and identify all of the individuals with whom you had an effective contact. And if you are asymptomatic, then we are going to make some assumptions, unfortunately, but we kind of have to. And so we're going to basically assume that you've been shedding for maybe a couple of days, right? If you test positive today, you are shedding. That's what the test means at this point with the PCR test that we're using. And so if you're test positive today, you're shedding today. And we generally expect that shedding may occur 2 to maybe a few more days prior to onset of symptoms. And so we go back and ascertain who your contacts were 2 days prior to this test. And then we start reaching out to those individuals, figuring out, did they actually have an effective contact with you? And so that is defined currently by the CDC as being within 6 feet of an infected individual for approximately 10 minutes. And so just passing by someone in the aisle at Walmart is not an effective contact that we would pursue contact tracing for. But if that person has had contact with you, then we're going to make them aware that they've had contact with an infected person. We won't disclose who the individual is out of just respect for privacy and the patient's right to not have that information disclosed, but we'll tell them that they've had an effective contact, that they need to be aware of that. They need to be aware of any symptoms that they may develop. We would encourage them to get tested, and we'd also encourage them to quarantine for a reasonably protracted period of time to minimize the risk of them spreading the disease prior to getting it all clear that they no longer pose a risk.
Well, Dr. Taylor, I know the state has really been ramping up. Folks there at Oklahoma State have been doing a lot of it, ramping up the number of tracers you have, people working it. How would you describe how it's going so far in Oklahoma as far as folks participating in it and as far as you getting a handle and getting the contact tracing that you want to be able to get?
So there currently are approximately 350 trained contact tracers in the state of Oklahoma. And these are individuals, generally speaking, employed in the county health departments, highly trained individuals who have an understanding of this disease in particular, as well as disease transmission in general. And that number has essentially been adequate to trace, we feel effectively, the number of cases that we've been having as transmission diminished. But we certainly recognize the possibility of that overwhelming the system. And so the plans are to train an additional 500 to 600 in the next couple of months and have sort of this whole army of individuals prepared to be going out and doing this, because it's very time sensitive, right? I mean, again, we're talking about identifying 2 days prior to symptoms. And the symptoms may only last a handful of days. And so it doesn't do us any good to be reaching out to you 6 weeks after the fact. And of course, there's limitations on what you're going to be able to remember at that point anyway. So it's very time dependent. And so we anticipate having certainly an adequate number of people and a robust system that allows us to proceed as the state opens up. And hopefully we don't get a large number or continued reemergence of cases. We've certainly seen an increasing number of cases throughout the last week or so. We're hoping that trend does not hold, but we're preparing to be able to respond to that as needed.
Dr. Taylor, you kind of mentioned you're not going to disclose a patient. There are folks that have expressed privacy concerns with the whole contact tracing idea. How do you reassure them?
Well, so there's a couple of things. One, legitimate contact tracing is never going to seek to violate that person's own individual privacy or things that we have no business being involved in, right? And so we're not going to inquire about social security numbers, bank accounts, anything like that. And so it's not unlike the census, right, that we're doing right now, that there are the potential for scams and people coming in and seeking to utilize this as an opportunity for gaining inappropriate information. And it's important to recognize that honest efforts at the census and honest efforts at contact tracing are going to be restricted to very critical information to allow us to do that. So that's one thing to recognize. And the second is that we're not seeking to make this onerous on those people, make it a burden on them. We're not going to be intrusive into their life in general. We're looking out for them. We're trying to serve them and their family members and their friends and neighbors and protect our community as a whole. And so, we're only going to inquire as to their contacts and where they've been And then we're going to provide them guidance and suggestions in terms of following up with their healthcare provider or their health department or so on and so forth. And then we'll also provide services if they wish, a way for them to respond to us in terms of symptomology. If they do start becoming ill, what that means, what to do about that, and those kind of things. But we're going to keep that very respectful of that individual's autonomy and right to privacy and those types of issues.
Now, parts of the world, and even here in this country, are starting to use technology, apps to help in the tracing. Is anything like that going on here? Are there any plans for advancing this through technology use?
I'll answer sort of at two different levels. So one, I've been working with the university. At the university, the Oklahoma State University, looking at reopening in the fall and what are we going to be doing. And then you've got the state level. And at the state level, we're a little less inclined to look at any widespread technology adoption. Now, the Oklahoma State Department of Health will be using a program that allows contacts to opt in to receive text messages for symptom checks during their quarantine period, and then it'll provide additional guidance to them if they reply yes. So those individuals who don't necessarily want to be getting a phone call but want a reminder and some additional information, we are looking at utilizing some fairly simple technology to do that and allow them to remain in contact with the health department. But we're not looking at some of the more robust technologies that you would see that actually look at contact tracing through GPS, Bluetooth, or cellular signals, or those kind of things. At the university, we are looking at potentially some utilization of those, although we still want to be very careful of respect for privacy, and there are limitations on all of those technologies. They're not a panacea, and so we feel like it's most important that we have real, live, sentient, knowledgeable individuals who can reach out to you, provide information to you, gather appropriate information from you, and then figure out how to use that. But technology in the world we live in, of course, is ubiquitous, and so there are some neat opportunities, and I do believe that again, in a tight-knit community such as a university, there's some opportunity for those to be employed.
Well, you bring up the university. What are your thoughts as 28, 30,000 students all coming back? And I mean, I know what's going to be the key from your point of view as these students come back to school?
So I'm reasonably optimistic that we can make this work well. The university has been very diligent and very deliberative, and those efforts are ongoing and will continue to be developed as we move closer to reopening, and they're going to be responsive. I mean, I think everyone has recognized the need to be responsive as conditions change, but I am optimistic that it can work. But the message to the students, to the faculty, to staff, to the is the same as what we have to the citizens of Oklahoma. They have immense power. Our people have immense power to control transmission of this disease. And so, if we wear masks, if we social distance appropriately, if we take prudent measures in terms of sanitation and disinfection of surface contacts and those kind of things, I believe that we can have reasonable activities and interaction with individuals with manageable risks. It's also important that we are aware of the symptoms and some cases the absence of symptoms, and that we not become overly confident that we're not infected, we don't pose a risk, we don't need to worry about wearing a mask or doing these other things, because asymptomatic transmission is certainly possible, and either before symptoms emerge or even in the total absence of symptoms. And so it's critical that everyone follow these guidelines of wearing masks. They do work to reduce transmission. Maintain social distancing when possible. Practice, if you are going to congregate, being outdoors is much safer than being indoors, and again, disinfection and sanitation.
Yeah, if you have any concerns about, if you don't want to get involved in contact tracing, do what you just said,
That's
and
it.
and you won't need any contact tracing.
That's the hope. Yes.
Dr. Taylor, anything else on your mind that you feel is important for me to pass on when it comes to contact tracing that I haven't touched on?
So while what you said is exactly true, what we hope is that if you follow these steps, you won't be contacted and you won't become involved in contact tracing. But if you get a phone call, we ask that you understand the importance and significance, that you cooperate with the health department in their inquiries, that you provide them all the information that you're seeking, that you be patient with those individuals. Again, we've got a large number that are trained and professional and very familiar, but we're bringing new individuals in and trying to train them as well. And so they're going to do a great job. We have confidence, but it's going to be a challenging task. And so we ask that you be cooperative, that you be patient, that you understand that their goal is very much to serve and protect you and your family and your friends and your neighbors, and that you be respectful of that and assist them. If it comes to that point that you are contacted for contact tracing, that you understand the importance of that as well, and you engage in that appropriately.